Greetings, I'm Ricky DeMello, and I'm a student at the New York University Tandon School of Engineering. This presentation is a post-Amerithrax biodefense system. What is Amerithrax? That refers to when letters containing Bacillus anthracis, or anthrax, were mailed to American citizens. Anthrax, just by the way, is fatal to humans if spores get into the human body and are activated. More on this later. Anthrax can be inhaled, touched, eaten, or injected. Details about the letters. The first set of letters were mailed between 5 p.m. on September 17th and noon on September 18th. They were postmarked in Trenton, New Jersey, so it's thought that they must have been mailed from somewhere there. They were sent to New York Post in New York City, New York, Tom Brokaw, an NBC news anchor in Manhattan, New York, and American Media Inc. in Boca Raton, Florida. Another set of letters, the second set of letters, was mailed between 3 p.m. on October 6th and noon on October 9th. They were postmarked in Trenton, New Jersey as well, thereby further supporting the fact that the people mailing them must have been mailing them from somewhere near Trenton, New Jersey. These were sent to Senators Tom Daschle and Senator Patrick Leahy in Washington, D.C. As it turned out, 22 people in different states were infected with anthrax. 5 of them died. This caused a nationwide panic and abuse of this panic. More on this later as well. Simple point was, you couldn't trust the mail. An investigative task force was formed immediately after the first death of Robert Stevens on October 5th in Boca Raton, Florida. This task force was a partnership between the Federal Bureau of Investigation, or FBI, and the United States Postal Inspection Service, or USPIS. 7 years later, Dr. Bruce E. Ivins was charged as the perpetrator. He committed suicide shortly thereafter. The point is, it took 7 years to decide on a perpetrator. This shows deficiencies and gaps in the biodefense system. First off, there needs to be a way to better inform the nation of the ongoing circumstances. People were panicking, they were overreacting, people were being abused because of the panic they were going through. This is because the nation wasn't informed on the status of the research being done or the investigation that was ongoing. First responders need to be better trained. This includes EMTs, physicians, police officers, people first on the scene, people first to realize, oh, there's a biological threat occurring, something of that nature. They need to be better trained because they need to be constantly aware. The ones for Amerithrax did a great job, but that's even more support that we need to keep better training our first responders in a post-Amerithrax biodefense system. There also needs to be better communication between investigative parties, such as the laboratory scientists who in multiple universities were doing research for the anthrax attacks, as well as law enforcement, which had its own labs, but then there were police officers and federal agents, and everyone needed to be kept in the loop. This is another support of the communication that was in between parties might have been done well for Amerithrax, but that's all the more reason to better it even further. And above all, there needs to be further research in cures to things like anthrax and other biological agents, fatal ones especially, major health hazards. There needs to be better research, there needs to be more research on cures for it, and we need to stockpile those cures. So, how to better the biodefense system? Well, let's consider the history of the biodefense system and bioweaponry overall, the need of a biodefense system, the functions that would be included, the feasibility of a biodefense system, the challenges and potential solutions to the challenges of the biodefense system, and the response to Amerithrax as a starting point and as the current status of where the nation is today. And so let's start with the history. As Table 1 shows here, biological agents and biology has been used as weaponry since 1155, and this is the recorded material. So it's likely been used for over 1,000 years. The efficacy is not entirely known, but people kept trying, and that's the point. In this chart, in this list, as you can see, smallpox was spread, and this was successful. So Native Americans and Confederate soldiers who sold clothes to Union troops, these were successful attempts as using biological agents as weaponry. As Table 2 shows here, this is a list of how biological agents have been used repeatedly and more frequently. The First and Second World Wars had repeated use of the multiple biological agents, including anthrax, which is marked as one of a major public health hazard. And as can be seen, it was last used in 2001 for Amerithrax. But there are other agents here, such as the plague and food poisoning even, that have been used in Second World War or other wars. And so that's why it's using bioweaponry and biological agents for warfare are nothing new. And so the First World War, what it comes down to is Germany used weapons of mass destruction before anyone else. This included biological weapons. They were small scale about it and not very successful. German soldiers mostly tried to infect animals and contaminate the animal feed. Perhaps they thought this would have an effect on the soldiers. They couldn't eat the animals perhaps, or couldn't eat what the animals were making. But the point is they were going after the animals more so. But this caused other European countries to invest in the same, in bioweapons as well. And America started being pushed by countries like France to also invest in and research bioweaponry. When the Second World War came around, the Japanese really invested a lot. They went large scale on bioweapons. In other words, they killed a lot of people in the name of research. As the quote here shows, the Japanese army poisoned more than 1,000 water wells in Chinese villages to study cholera and typhus outbreaks. Japanese planes dropped plague-infested fleas over Chinese cities or distributed them by means of saboteurs in rice fields and along roads. This got to the point where the move the Japanese soldiers took continued to kill more than 30,000 people in 1947. So this was something that the US took as a reason to invest in and research bioweapons as well. So the history of US biodefense and offense does not seem to have caused many deaths or any deaths that have been recorded anyway, at least in testing and research. But it is to be accepted that test animals were exposed, human volunteers were exposed, and unsuspecting civilians were exposed to both pathogenic and non-pathogenic microbes. For example, the US military released bacteria from naval vessels off the coast of Virginia and San Francisco. This infected many people, including about 800,000 people in the Bay Area alone. And then to top this, actually, there was the most infamous test in 1966, which contaminated the New York metro system with Bacillus globigii, which is a non-infectious bacteria used to simulate the release of anthrax. This was done to study the spread of the pathogen in a big city. This research and examination led to President Nixon signing the Biological Weapon Convention, which prohibited the use of biological weaponry, as well as the research into it. So there's that, but the thing is, there's no verification system. So while the BWC currently has 183 signatories, there's a country can sign it and say it won't do the research, but then do it anyway. Russia, for example, has admitted to breaching the BWC. The Soviet Union's bioweaponry is shrouded in mystery because it might be destroyed, still in Russia, sold to other countries. We don't know. And so, there is a need for the development of an effective and efficient biodefense system. Countries are advancing research into biological agents and developing bioweaponry. Many corporations, religious organizations, groups of people, and individuals are doing the same. Due to the affordability of biological agents and bioweaponry as technology advances, they're becoming the poor man's nuclear bomb, as is commonly known. Plus, after Amerithrax, when people were panicked, overreacting even, others started sending letters containing only white powder of some sort, and this was done to threaten the recipients or to scare them. And so that's why the need for a biodefense system is both need-driven and technology-driven. This means that for the betterment or lack of harm to society, there's a need for a more efficient and effective biodefense system. As technology advances, the need for the biodefense system is advancing due to technology as well. That's why it's need and technology driven. So, with the biodefense system being the system, there must be subsystems, and in this case, I've categorized 4 of them. There's the signal, data, material, and energy. The signal can be simplified into communication of the issue, data, gathering of information concerning the issue, material, tangible results with regards to the issue, and energy are elements which provide motive and running power to the system. Signal functions. First one, realize the occurrence, details, breadth, and status of the attack, including, for example, the biological agents used, whether the attack is complete or is ongoing, etc. Members in the medical community, such as the EMTs, nurses, physicians, etc., are often marked as the first responders. This is because, especially if it's a covert attack, a patient might feel a sudden onset of illness and have to go to the hospital. It's at the hospital that the tests will occur and the doctor will be able to realize that something strange is afoot. This is when a doctor should be made aware or should figure out that there is a biological threat occurring. For example, for Robert Stevens, the first person to die with the anthrax attack in 2001, Amerithrax, Robert Stevens, when he was diagnosed with anthrax, the medical professionals in charge reached out to Florida Department of Health to inform them that a biological event might be occurring, since anthrax is rare in Florida. So, another signal function is to inform the public of dangers to be wary of while calming the public away from overreacting, including such dangers as, for example, reach of attack, chances of further attacks, fatality risks of illnesses caused by the attack, contagiousness of illnesses caused by the attack, violence erupted amongst citizens against each other due to the attack, etc. During Amerithrax, had the public been kept better informed about what to look for, what to suspect, what to bring up, etc., chances are strong that overreactions that overwhelmed local, state, and federal authorities would not have occurred. For example, had people been known to be wary of white powder, but to understand that these were issues that had been located in Florida and New York and DC, and that's it. There are multiple other states that people might have been a little bit better aware that, oh, this might not be anthrax. But the chances were no one knew where things were going and no one knew what was going on because the biodefense system at the time was still investigating. So there is that too. But had people been better informed of the research being done on things such as the cures, the investigation, they might have had a better chance at not overreacting about just getting letters. The data functions. Analyze the attack, including, for example, such things as details concerning the attack source and site, properly collected samples of the used biological agents, deducing key details concerning the collected samples after identification. For example, how fatal, how contagious, how to cure, etc. So for this, to investigate how Robert Stevens became infected, researchers examined locations where he had been over a period of 60 days prior to the onset of illness. This included locations he'd visited, such as retail shopping outlets, or his home, his work, recreational destinations, such as movie theaters, etc., as well as people he'd encountered, such as coworkers. They were examined by having nasal swabs done on them to figure out, to discern whether they were infected as well or whether they were in danger as well. And so there's also, for data functions, statewide laboratories directors for Amerithrax were informed to be on the lookout for anthrax, and if they came across any infected people, to inform the FDOH as well. This is how news was spread around. Hey, this happened in Boca Raton. If it happens to where you are in Florida, please tell us because we're investigating what's happening. No one knew what was going on at the time. As for treatment, anthrax is curable by antibiotics, but the treatment must begin as soon as possible. If the spores are activated inside the human body, the bacteria multiply and spread toxins. There are currently only a few antitoxins available, and hence the need for antibiotic treatment to begin swiftly. Once the bacteria is in your body and spreading toxins, we don't have that many antitoxins that are effective currently. And so that's why this anthrax is something we need to be very wary of. Material functions. Deliver curative components to affected areas and or people, including such components as, for example, medicines, vaccines, nutrition, medical care professionals, etc. When a cure is known, as it was with anthrax, is discovered or is created, institutions like the Center for Disease Control and Prevention, the CDC, bear the responsibility to provide any or additional samples to hospitals and similar healthcare facilities. That's simple. If there's a cure that exists or research has been done to discover a cure or to create a cure, we need to make sure people get it. And that's one of the material functions of a biodefense system that's post-Amerithrax. Another material function is to investigate and hold the source responsible by appropriately taking measures, including such measures as, for example, informing law enforcement, the government, the Federal Bureau of Investigation, etc. For Amerithrax, the task force was created for this reason. Due to the complexity of the investigation involved, i.e. going from suspecting people and countries in the whole world to deciding upon a laboratory researcher named Dr. Bruce Ivins, it is understandable that the matter took 7 years to conclude. And so that's the thing is, another material that results from this biodefense system that'll be post-Amerithrax and ones before as well is investigation into who brought this biological attack about. That is something that's pretty important because that way it can be figured out whether previous ones had been done that had gone unnoticed, or whether more were planned, whether more are going to happen. And so that's why it's important to know such details as who caused this and where are they and how can we bring them to justice. The subsystem energy functions. Legislation, whether it be state or federal, to guide the public through the burgeoning issues with regulations that do such things as, for example, mandate communication of suspect issues to state and federal authorities, declaration of public health emergencies, temporary suspension of laws that burden response, etc. For Amerithrax, the Center for Law and the Public's Health at Georgetown and Johns Hopkins Universities drafted model legislation for states to update their existing laws with. The model legislation seeks to effectively detect the problem and effectively respond to it. For example, The model law told states that when there is a public emergency, pharmacies, hospitals, outpatient services, and other healthcare providers should notify public health officials who would then inform law enforcement of peculiar circumstances concerning people's health, something usually kept confidential. When someone goes to a doctor or pharmacy, someone's not expecting that information of what you're being given or what you're being diagnosed with to be told to the police. But when it's multiple people that come in with a certain issue that is not common in the area or the type of people coming in with it, that is something that is a sign of a biological event occurring, as it was with Robert Stevens and anthrax. This is why the model laws now state that suspend the laws of confidentiality when something that out of order is occurring. And so, overall, the point is laws that prioritize protection, including laws that deactivate other laws, are needed in emergencies. So, a big point here is that the subsystem's signal, data, material, and energy, what needs to be understood is there are often unforeseeable circumstances that arise, and a core concept that a biodefense system must include is malleability. By being able to alter substantially or adjust slightly the biodefense system when appropriate, the nation stands a better chance at mitigation of and swifter recovery from bioterrorism. If the biodefense system isn't working for certain issues, you're going to need to change it. And that's something that needs to be accepted and kept inherent in every biodefense system. The feasibility. Feasibility due to possibility is not questioned. Researchers can advance technology to create and counter bioweaponry. Advancing technology creates a bioweaponry. It may take a bit longer, but technology advancements can also then counter the bioweaponry. It is whether there's funding enough to perform the research needed that counts. This is where taxes and government spending on institutions like the Department of Defense come into play. For example, after Amerithrax, the Bush administration led an urgent push to biodefense, both by expanding past programs and forging new initiatives. By 2002, biodefense spending had gone up to above $4 billion, nearly an order of magnitude above the $633 million spent the year before, according to this quote. By 2005, the money went up even more. It had gone up to $8 billion before leveling off and while coming back down to around $5 billion annually over the next decade. These changes in the U.S. policy and funding set in motion by the attacks fundamentally transformed the landscape of national biodefense and formed the foundations of current strategies. Though today the country still remains vulnerable to bioterror, it is a point to note that a lot of money is being spent in biodefense to protect us from the bioterror. There are still challenges, as I just mentioned, and response to it as well. One of the challenges is programs such as BioWatch and BioShield were created as a result of Amerithrax by the moves of President George W. Bush. The idea was to invest more in detection of biological threats through BioWatch and research, produce, and stockpile through BioShield and other programs of cures to biological threats. As the U.S. government has worked and invested more money on this, about $65 billion, for example, there's been nothing much to show for that investment. There have been no groundbreaking discoveries on potential cures or anything like that, at least none that have been made public. But the response to this is to bear the expenditure, because their research for healthier security takes longer than the research needed to come up with new ways to kill people, especially or even with biological agents. Because when a cure is made, you have to make sure that the cure applies to everyone under all circumstances, or you need to figure out who it applies to under what circumstances. Cures take a longer time because They need to undo harm that's been done, whereas the harm that's been done will be done by potential cures that were just created wrongly. So that's why we need to bear this expenditure we just need to bear this expenditure. Plus, there's the thought that without these costly programs, the country would have an outdated biodefense against the more fatal, ever-cheapening bioweaponry and biological agents. As time progresses and biological agents are used to better bioweaponry, biodefense systems are going out of date. This is why we need to constantly keep researching and constantly keep spending money to do so. Another challenge is those responsible for responding to biological threats, especially first responders, need to be aware always and alert always. Thing is, they might lack the required constant vigilance. They might not be trained appropriately. They might have machines that are relied upon malfunction. The response to this is preventative maintenance in the form of training followed by emergency drills that must be performed. And the thing here is all professional responder programs already have drills, and that is why response can be relied upon. Equipment, for example, is often examined and tested as well to confirm proper function. This is how people and the machines they use can be always ready. Another challenge, failure of people and machines may occur despite all preparedness via drills, tests, certifications, etc. What then? And so this is where we need to think more is better than a few. Corrective maintenance must be utilized through the form of redundancy. Multiple doctors that review a patient's symptoms to decide upon the illness will be better than the one doctor who might make a mistake. Multiple ways for parties to connect so that a failure in one of the ways does not cease communication is going to be pretty key. If you can call and text someone, that's likely better to get the message across when in an emergency than just saying, oh, I'll just call. Multiple experiments to confirm the data are also key when experiments are run because of a factor that no one saw that affected the result. The results might be off. This is why multiple experiments to confirm the resultant data is something that must be kept in mind and performed. Overall, the point is multiple instead of sole reliable resources better ensure an effective and efficient biodefense system. And so, the National Biodefense Analysis and Countermeasures Center, NBACC. This is an advanced response system as a response to Amerithrax. This is a world-class, one-of-a-kind facility located in Maryland, Fort Derrick, Maryland, and what it does is it provides intelligence assessment, preparedness planning, response, emerging threat characterization, and bioforensic analysis. These are key features when dealing with biothreats because intelligence assessment, for example, you need to figure out what you already know about what this attack could mean. Is it from another country? What intelligence does the nation have? Preparedness planning. How are we going to respond to this? The actual response. The emerging threat characterization. What level is this threat on? And bioforensic analysis. Where did this come from? What does it entail? How contagious is it? What are the details? The NBACC oversees support of federal law enforcement investigations and research to better understand biological threats. These two duties allow for swifter investigations and prosecution, as well as better response to biological threats. The way this works is, because the NBACC is there for federal law enforcement and law enforcement, even state, to turn to with questions, they're there to help support and oversee what's going on, and for researchers to turn to with potential cures or potential further biological agents to fill the library of what to look out for. This is why the NBACC is a good central biodefense system. So, The NBACC, because of this center location, partners with multiple other agencies. Some of them include the FBI, the DoD, the Food and Drug Administration, U.S. Army Medical Research and Material Command, the National Cancer Institute, and the Center for Disease Control and Prevention, plus others, of course. But that's the point. Is the NBACC is there connecting multiple other agencies and institutions with each other, because a better informed nation is a better way to get a better biodefense system. And so the NBACC is the post-Amerithrax biodefense system. This is where it stands today. It is constantly evolving to get more effective and more efficient. The overseeing, the intelligence provided, the bioforensic analysis, the multiple ways that the biodefense system through the NBACC connects to multiple agencies and institutions and universities, people, that's the way it's going to work. It needs to be connected so people can be better informed by informing each other through the NBACC. As President Nixon stated in his statement on chemical and biological defense policies and programs on November 25, 1969, mankind already carries in its own hands too many of the seeds of its own destruction. By the examples we set today, we hope to contribute to an atmosphere of peace and understanding between nations and among men.